Hello, my name is Julia LaValle. The fetal assessment that I chose for this week's assignment was the non-stress test. The overarching goal of antepartum fetal surveillance testing is to reduce the risk of fetal demise. The non-stress test is a test that monitors the fetal heart rate in response to fetal activity or fetal movement. This test uses external abdominal transducers to monitor the fetal heart rate without placing any stress, which would be a uterine contraction that constricts umbilical cord blood flow to the fetus. The Doppler ultrasound transducer monitors the fetal heart rate, while the tocodiamometer detects any uterine contractions and fetal activity. Fetal activity can be noted and timed by the patient herself or by the staff performing the test. The staff member will note any important findings such as the baseline fetal heart rate, accelerations, variability, and decelerations. The non-stress test has been used for over 50 years as one of the initial non-invasive interventions to determine fetal well-being in high-risk pregnancies. According to ACOG, antenatal fetal surveillance is appropriate to begin at 32 weeks gestation for high-risk pregnancies. Performing this type of test prior to 32 weeks gestation has a higher incidence of false, non-reassuring results that are more likely to fetal immaturity than fetal demise. It is also recommended that abnormal results may be repeated depending on the specific indication and the provider's clinical judgment. Then additional fetal surveillance testings that are more invasive will take place. Since the test is fairly basic and the results are considered just normal or abnormal, this test has a fairly high sensitivity and high specificity. The non-stress test is indicated for both maternal factors and fetal factors. Maternal factors include gestational hypertension, preeclampsia, gestational diabetes, sickle cell disease, renal disease, thyroid disease, IVF pregnancy, advanced maternal age, obesity, history of poor pregnancy outcomes, post-term pregnancy, polyhydramnios or oligohydramnios. Fetal factors include intrauterine growth restriction, multiple gestation, fetal anomaly, and decreased fetal movement. Non-stress tests are non-invasive, so they're generally not contraindicated. However, caution should be taken initiating antepartum fetal surveillance prior to 32 weeks gestation due to a high risk of false abnormal results. A high rate of false abnormal results. Any false abnormal result can cause unnecessary interventions to take place. Therefore, proper antepartum surveillance should be individualized based on the patient's indication, risk factors, and gestational age. So the NST procedure. The equipment used in an NST is a cardiotocograph, which records uterine contractions and the fetal heart rate, and a vibroacoustic stimulator, which is also called an artificial larynx, which can elicit fetal heart rate accelerations. So the procedure itself, the patient starts by laying in the left lateral position or semifallopian position. The Doppler ultrasound transducer is placed on the abdomen to monitor the fetal heart rate, and the tocodiamometer is placed on the abdomen to detect uterine contractions or fetal movement. The test is approximately 20 to 40 minutes long, and vibroacoustic stimulation can be used to prompt fetal movement. The advantages with the NST is that it's a non-invasive way to evaluate fetal well-being. It allows providers to identify the risk of fetal hypoxia and fetal demise. This type of test is so non-invasive, though, it can be seen as a disadvantage. This is because it doesn't give us much information, as there is no real diagnostic value associated with the test. The results are reactive or normal, or abnormal, or non-reassuring. However, non-reassuring results are quite vague, as repeat or alternate testing is indicated. Despite the vagueness of the test, an abnormal result can make parents feel very unsettled. It is important as a provider to provide support and ensure the parents more testing will take place to get to the root of the problem. Results of this test are considered reactive or non-reactive. Reactive means there is normal fetal autonomic function, or two fetal heart rate accelerations that increase by at least 15 beats per minute for at least 15 seconds. Non-reactive results mean the fetal heart rate lacks sufficient accelerations. Other abnormal findings that can be found in this test is variable decelerations, or a rapid decrease in fetal heart rate lasting no more than 30 seconds, repetitive variable decelerations, or 3 variable decelerations in 20 minutes, or a prolonged deceleration or decelerations lasting more than 1 minute. If you are to receive an abnormal finding, the provider will either repeat the NST or then go on to more invasive testing, such as the biophysical profile or the contraction stress test. Important client teaching and education and counseling include educating the patient about the test purpose and procedure prior to scheduling, informing the patient that the test could take about 40 minutes, educate the patient on their results, and then for an abnormal, non-reactive result, explain to the patient that this test provides limited information and repeat testing or alternative testing must be performed to confirm the status of the fetus.